What are the treatment options for a dog with a retained placenta?
Hey everyone, welcome back to our channel. Today, we'll be discussing the treatment options for a dog with a retained placenta. It's important to remember that retained placenta in dogs can be a serious condition that requires immediate attention. So, let's dive right in and explore the treatment options available.
What is a retained placenta?
Before we delve into the treatment options, let's briefly understand what a retained placenta is. A retained placenta occurs when a dog fails to expel the placenta after giving birth. Normally, the placenta is expelled shortly after each puppy is delivered. However, in some cases, it remains inside the dog's uterus, causing potential complications.
Veterinary examination.
If you suspect your dog has a retained placenta, the first step is to seek veterinary attention. A thorough examination by a veterinarian is crucial to confirm the diagnosis and determine the best course of treatment. During the examination, the veterinarian will evaluate the overall health of the dog and may perform diagnostic tests such as an ultrasound or X-ray to assess the condition of the uterus.
Natural expulsion.
In some cases, the retained placenta may be expelled naturally without any intervention. The dog's body will often initiate this process on its own, and the placenta will be expelled within a few hours or days after giving birth. It is important to closely monitor the dog during this time to ensure that the placenta is expelled completely and that there are no signs of infection or other complications.
Medical intervention.
If the placenta does not expel naturally or if there are signs of infection, medical intervention may be necessary. The veterinarian may recommend the administration of oxytocin, a hormone that helps stimulate uterine contractions and facilitate the expulsion of the placenta. Oxytocin is typically given as an injection and can help promote the contraction of the uterus, leading to the release of the retained placenta.
Surgical intervention.
In more severe cases or when medical intervention is unsuccessful, surgical intervention may be required. The veterinarian may opt for a procedure called a manual removal of the placenta. This procedure is performed under general anesthesia and involves manually removing the retained placenta from the uterus. It is important to note that surgical intervention is considered a last resort and is typically reserved for complicated cases.
Post-treatment care.
Once the placenta has been expelled, whether naturally or through medical or surgical intervention, it is crucial to provide appropriate post-treatment care. The veterinarian may prescribe antibiotics to prevent or treat any potential infections. It is also important to monitor the dog closely for any signs of complications such as fever, lethargy, decreased appetite, or abnormal discharge. To wrap up, a retained placenta in dogs is a condition that requires prompt attention and appropriate treatment. Remember to seek veterinary care if you suspect your dog has a retained placenta. Treatment options can include natural expulsion, medical intervention using oxytocin, or in severe cases, surgical intervention. Always follow your veterinarian's recommendations and provide necessary post-treatment care. We hope this information has been helpful, and if you have any questions, please feel free to leave them in the comments below. Thank you for watching, and we'll see you next time.